Ladies and gentlemen, may I have your attention, please?
Covering both sides of the big issues with the analysis you trust on News Radio 1040 WHO.
Just a few weeks ago, cardiologist Dr. Fahmi Farah was on with me, and we were talking about broken heart syndrome. Can you actually die of a broken heart? You know what makes me think about this at this time is because the show Obi-Wan Kenobi is now on Disney Plus, and you'll remember that, Padme apparently died of a broken heart in those early Star Wars movies after having Luke and Leia. Spoiler. And I've always wondered about that. I'm like, is that a thing? Could that actually happen? Because it happened in Star Wars. Now, here's an update. This is one of those you can't win updates. There are some folks who believe that happy heart syndrome can hurt you too. Cardiologist Dr. Fahmi Farah back on the line with me. Dr. Farah, good morning. Welcome back to Iowa Radio.
Good morning. Thanks for having me.
Okay, is this a thing, Dr. Farah? Because, look, I'm concerned. I'm a happy person. Can you actually die of a happy heart?
So I want to clarify.
Okay.
So this doesn't mean that somebody who's just living a happy life is going to die of happy heart syndrome. No, that's not what this means. This is more like a sudden occasion that causes an extreme excitement. So to give an example, say it's a surprise birthday party, and that surprise can cause a surge of sympathetic nerve firing in our body, and that would cause a huge surge of adrenaline rush. And it's that adrenaline rush that causes, that could be detrimental to the heart at times. And that's what we're talking about. It's not to say that you don't live a happy life. No, be happy. We want everybody to be happy. It's more of a sudden thing that we're talking about.
That would be worst birthday party ever, wouldn't it, Doctor? Surprise! Thump. Oh, man. Terrible. Anyway, I'd feel guilty for a while, but I'd still want cake. Anyway, so is there any pre-existing conditions, though, Dr. Farah, that made you more likely that maybe an exciting event like realizing you've won the lottery could actually hurt you?
This is actually one of the situations where it can, yes, because that's another really great example is winning the lottery. That sudden surprise and the rush of all those chemicals in our body, like the catecholamines, can cause something like happy heart syndrome. And the two are actually really similar. Both broken heart syndrome and happy heart syndrome, the mechanism behind it are very similar. They're both sudden onset heart failure, basically. So heart is a pump, and it just means that the pump is not working as efficiently as a result of that shock that you're receiving.
So, Dr. Farah, overall, though, you realize that's why I gave you a call, because I think of myself as a happy person, and I don't like to hear about stuff like happy heart syndrome. But is there actually medical evidence that being happy overall does increase your heart health?
Absolutely, yes. Stress is a known risk factor for heart disease, and so we know that depression, anxiety, people who are depressed, there's evidence that they are at increased risk of having heart disease, serious conditions like heart attack, heart failure, hypertension, hyperlipidemia, all the risk factors as well. And the reason being is it's not just the physical and the mental state itself. It's also like the unhealthy habits that we kind of get into as a result of our unhappy state. So when we're unhappy, we're less inclined to work out. We don't have the motivation to eat healthy. So all those things contribute to the increased risk of heart disease in those patients. Whereas somebody who's living a happy life, they're more motivated to do all those things. They're going to be going to the gym. They are going to feel good about themselves to eat healthy. I think there's no doubt about it that there's that role.
So you got me obsessing now over your birthday party example, Dr. Farah. So is there any sign, like if my friend has the potential of actually having an incident, if I have a surprise birthday party for her, anything that would warn me in advance before I did it? Should I ask my friend? Is there anything I can do to stop this from happening?
Then it would, if you ask your friend, it would ruin the surprise.
Yeah, I know. What a position to be in.
No, we can't do that. Well, I actually I'm glad you asked. I don't want people to be panicked about having a surprise birthday party or being happy. That's not the point here. I do want to make sure people understand that happy heart syndrome is an extremely rare condition. Broken heart syndrome, on the other hand, that's more common.
Yeah.
And that is actually more, we see that all the time. So it's very common. It usually happens in people who go through enormous amount of stress, like a really bad thing happening, like a divorce or a loss of a loved one, like a death of a family member or a spouse. Typically is the more common one. And it is more common among females, the broken heart syndrome. Whereas the happy heart syndrome is actually pretty rare. It doesn't happen very frequently. And it is noted to be seen more in males, which is interesting. So it's a lot more prevalent in males than females in the limited number of studies that we have, the limited number of data that we have on this particular condition so far.
Cardiologist Dr. Fahmi Farah, she is always fascinating on these topics, and that was a fascinating little fact right there. Dr. Farah, thanks very much for joining me.